Hello and welcome to Health Professional Radio. Thank you so much for joining us today. Konica Minolta Medical Imaging is a market leader in medical diagnostic primary imaging solutions, and the company is focused on collaborating with healthcare providers across specialties and disciplines to vastly improve the use of primary imaging at the point of care. Primary imaging includes digital radiology, ultrasounds, and the like. And our guest in studio today is Guillermo Sander, Konica Minolta's Senior Strategic Marketing Manager, and he's here today to talk with us about some of the recent advances in diagnostic medical imaging overall and the related IT platforms that accompany those advancements. How are you doing today, Guillermo?
Thank you very much. Thanks for having me.
As Konica Minolta's Senior Strategic Marketing Manager, what can you tell us briefly about some of the recent advancements in medical diagnostic imagery that your company's been involved in?
Well, thank you very much, Neal. There's been a lot of really good improvements that have helped physicians and healthcare professionals improve not only their workflow in terms of speed, but also the clinical confidence to make faster and quicker diagnosis. In primary imaging, which is the first image you get before going to more advanced modalities. So we focus really on
X-ray,
your basic X-ray and ultrasound, and some of the things that have been happening because now we're acquiring images digitally. We have come up with different image processing algorithms that very quickly allow you to do things like, for example, highlight catheters as they're being placed, so to allow the physicians to quickly see if they are in the right position.
Right, yeah.
Other things that we do in ultrasound, especially in the area of pain management. We have an ultrasound solution that's very well suited for musculoskeletal, and one of the main uses, or more popular uses, is pain management. And one of our image enhancements allows the needle to be painted in the color blue, which is, if you see an ultrasound, it's
better imaging when it comes to, say, the aspiration of joints, sacroiliac spine, and they need that joint aspirated. Better imaging than what we've seen in the past 10 years?
Oh, well, there's definitely been improvements in the image itself. You get better quality, the algorithms are better, we can translate that sound wave into a better image quality. Okay. But now, as we get more advanced, if we can identify that needle to make sure to differentiate it quickly, so you can place the medicine or extract the liquid exactly from the joint or the area or the targeted area, it increases. Well, first of all, it reduces the exam time significantly. Less time in pain is always good for everybody. But it also increases the accuracy because you know exactly where the
fluid is, the
needle, where the fluid was applied or removed, which is great. And it's changing a lot of how some of the musculoskeletal doctors are approaching pain management.
Now, when you were here in another segment, you mentioned briefly that you were instantly transmitting some of these images via the cloud, storing them in the cloud, instantaneous transmission from one location to the other. When we're talking about the internet, Wi-Fi, security and whatnot, how HIPAA compliant are these new developments from Konica Minolta's standpoint when it comes to HIPAA regulations and the transmission of these medical documents?
That's one of our key areas of concern. The cloud offers a lot of advantages in terms of size and accessibility, but at the forefront of all of this is our cybersecurity. Okay. And we do make sure that all of our information is properly encrypted and safe, because the last thing we want is to create an administrative nightmare for our customers by not providing the appropriate tools for HIPAA compliance. In fact, we invest a lot of our time, not just in HIPAA compliance, but some of our more regulated customers, require certain levels of security that are not run-of-the-mill. Think about
not
the
your
Department of
normal
Defense.
everyday, not your normal everyday, secure your normal everyday virus protection. Something above and beyond
Exactly.
that.
Oh
Now,
yes. So they are requiring a very tight levels, and we're very proud that we have been able to meet all the requirements, even exceeding some of our partners that integrate our detectors into their solutions.
Now, with the sweeping changes in healthcare here in the United States, with these advancements and the increased efficiency with these systems and their related IT platforms, are you seeing an increase in premiums as far as insurance is concerned, especially now that we all have to have insurance? What type of feedback are you getting from insurance companies, say Medicaid, Medicare, when it comes to covering the cost of some of these advances?
Frankly, it's actually the opposite.
Okay.
There's a lot of pressure to provide quality care, but to reduce the cost, the total cost to the system. So a lot of what we do is not focused on trying to generate additional reimbursement. Because we focus on the primary aspect of it, we do things like, for example, highlighting the needle, so the process is a lot quicker. We do other things like we just released a software called Intelligent Grid that simulates the use of a grid without having to having the physical grid. It's just image processing, which basically it improves the workflow. So the radiology technician that is technologist that is actually performing the image does not have to stop, get a grid, put it on the detector, take the exposure. Because it's done electronically, it helps improve the workflow and simplify the whole process of acquiring the image. Precisely because everybody is pressured to provide more with less.
Okay.
So a lot of what we do is to help them actually achieve more with less.
Now, as we wrap up, I've got a question that is consumer oriented. How much of these advances in diagnostic imaging are designed to help the consumer more understand what their provider is using the image for, or why it was taken in the first place?
We're slowly getting there. The changes have been likely a little fast and furious, and I think we're catching up. One of the things we've been doing through our approach to designing solutions, which is to really understand the drivers from a customer's perspective, is that the one thing that we're learning is that physicians are learning very quickly that patients are more demanding. They're taking control of their own health. We're all walking around with a little bands that take our blood pressure and tell us if we exercise enough for the day. And,
we're all Dr.
we
Internet.
Want our information. Yeah. So Dr. Internet is big, and we are starting to develop better tools to populate patient portals to help the patients understand the significance of the procedure that was done, what the image has been used for, and really help them understand what their diagnosis is and why the procedure was done.
Now, what do you recommend clinicians think about first and foremost when they're thinking about diagnostic imaging changes within their own practices?
Well, the one thing we've been investing a lot of time is to understand what outcomes are they looking for. In general, physicians are looking to improve not only patient outcomes, which is a quicker diagnosis, a more comfortable office stay, all of that, but also their own practice. It's been challenging to keep up with all the demands of the changing landscape. So doctors need to spend a little more time figuring out, okay, I need to improve this, and it's a big task. So what we help them understand is, okay, let's try to find your priorities. What's important to you? What's keeping you up at night? And really focus our efforts into fixing the bigger problems first, and start paving the way so we can have a process in place to help our customers improve their practice along with the patient outcome.
And where can our listeners get more information about Konica Minolta and the diagnostic imaging research that you're involved in?
Well, the best place is our website. It's konicaminolta.com/medical system.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Guillermo Sander this afternoon, Konica Minolta's Senior Strategic Marketing Manager, in studio today with us talking about the advances in diagnostic medical imaging overall and the related IT platforms involved. It's been great having you here with us today, and I'm hoping you'll return to talk with us in future segments.
Thank you very much.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.